vomiting, burning sensation in the abdomen. This is generally happens when the patient is having severe gastritis. Recently, one of my friend, he's a professor in one of the institute. He took Basti in that institute, and after the Niruha only, after the Basti, on the first day some slight discomfort was there. Second day, he after the Basti, after evacuation, he went to his home, and around 4 o'clock he started to get severe muscle cramps in the abdomen and severe pain in the abdomen. So he telephoned me and asked why it's happening like this. So generally this happens if the patient is having severe gastritis. So only thing you need to give is Madhifala Rasayana or some small dose of Avibhati Churna or Dhanvantaram Gutika or Shunti Dhanyaka Jala. This will help to subside this burning sensation in abdomen or pain abdomen, etc. Okay. So generally the patients with a severe gastritis, they will get the pain abdomen or burning sensation in the 1 or 2 Bastis. Third Basti onwards, it will become Satmya for them, so or the pain will subside. But in some condition, it will extend up to 3rd or 4th Basti also. So in such conditions, we need not to go further beyond the Yoga Basti. Fullness of abdomen, headache, parikartika, atisara, these are the another complications commonly encountered with the Basti. The remedies, Shunti Dhanyaka Jala, Lagu Bhojana, Ushnodagopachara, following the Patya. And again, if the disease condition is associated Upadrava is very severe, we can manage according to the particular condition. Anuvasana Basti, so it can be considered as retention enema. It can be considered as retention enema and generally administered after food, that you know, Ardrapani. Already I mentioned. Briefly I will finish. Only 5 seconds. Because one part we can finish. After this, another yogas we can. And this can be considered as a Brahmana Shodhana. Brahmana Shodhana. So this is a theory what I postulated in the last few years. Shodhana Rasayana and Brahmana Shodhana. So generally Shodhanas are Langhana in nature. Chatur Prakara Samshuddhi, Pipasa, Mahartatapo, Vachana Nidhyasascha, Vyayamascha. Chatur Prakara Samshuddhi. This is considered as Langhana or Shodhana in nature. But there are certain dravyas can be considered as Brahmana Shodhana. For example, Virechana with milk is considered as Brahmana Shodhana. Virechana with the milk. Dugdam cha mutram cha Virechana. Dugdha is Virechana dravya, but it is also a Brahmana dravya. So if the patient's bala is very less, we can give Virechana with the milk. So that is why it can be considered as Brahmana Virechana. Rajeshma Chikitsa, Kshira Virechana is indicated because the Rogi bala is very less. Similarly, Anuvasana Basti also can be considered as a Brahmana Shodhana. Because why it is Shodhana? Because after the Anuvasana administration, the Pakwashaya Kshobhakaraka Vata to some extent and the Mala from the Pakwashaya will be eliminated. So it will do Shodhana at the same time because of the Siddha Guna, it can be considered as Brahmana also. Not all the Anuvasana, according to the nature of the styla, is also very important. Another important thing is the Sneha Basti can be administered for a longer period, unlike Niruha Basti. Not Sneha Basti or Anuvasana Basti, but Matra Basti can be administered for a longer period. But again, when compared to Niruha Basti, Anuvasana Basti can be administered for a longer period. For example, if you take the Karma Basti, the number of Anuvasana Basti is more when compared to the number of Niruha Bastis. Right? So in that aspect also, we can consider Anuvasana can be considered for a longer period. Generally, Taila, Girta, Yamaka Snehas are administered as in the form of Anuvasana. Majja, Vasa are not advisable in the form of Anuvasana. Majja and Vasa. Why? Because Majja and Vasa are considered as Apakwa Snehas. apakva sneha. Because if you administer the apakva sneha through the rectal route, sahi abhishyandayet gudam. It will do the abhishandan of the guda and increase the kapha in the body, and the patient may have mandagni and parisrava. Parisrava. Yeah. So that is why generally apakva snehas are not advisable. Then ajanma maranam shastam. As you know, the anuvasana can be administered in the ajanma maranam shastam. So the apt terminology for the Basti is sneha Basti. But the common practice is anuvasana, that's why I also written anuvasana. Because sneha Basti is classified into sneha Basti, anuvasana Basti and matra Basti. Again, which one should be administered along with the yoga Basti, karma Basti? Whether we have to consider sneha Basti or anuvasana Basti or matra Basti. Matra Basti not sure because it is very little quantity. So we need not to consider in between the yoga Basti, karma Basti, karma Basti. Among sneha Basti and anuvasana Basti, which one should be considered? Why? We'll see after T3. So indication, neurological condition, musculoskeletal condition, GIT, orthopedic, all these things you know. Some of the important factors, I will say. It's also same for the Niruha, Utaka, this is also same. So some slight modification, glycerin syringe is there, steel syringes are available, or catheter we can use without injuring the patient. So bladder wash we can use, plastic bag. What we use is the same bronze netra with a small plastic cover. We administer the anuvasana basti because the dose of anuvasana basti depends on the quantity of the Niruha basti. Are you practicing like that? No. Because Niruha basti may be 500 ml, anuvasana basti 90 ml. That should not be. If Niruha basti is 500 ml, 1/4 sneha basti. If you are going to give sneha basti, it should be 1/4 of 500 ml. If you are going to give anuvasana basti, it should be half of that sneha basti. Like that, we have to fix the quantity of the sneha basti or anuvasana basti in between yoga karma kala schedule. Then Mishrana, again, Mishrana, the Ama Taila should not be administered. So that is why if you want to give Tila Taila as Anuvasana, it should be Murchita Tila Taila. Grita is not Ama Taila, Ama Sneha, because it is Pakwa Sneha. Already, Samskara is to get the Grita, we need to do some Agni Sannikarsha and Samskara. So that's why it's not Ama. Okay, so that's why Grita Manda Anuvasanam is already mentioned. Acharya mentioned, Grita Manda Anuvasana is also mentioned. And Saindava Shatapushpa, the general Prakshepaka Dravya for the Anuvasana Basti. And generally, 1 Masha to 1 Pala can be administered in the dose Anuvasana 50 to 60 ml for children, but it can be 50 to 300 ml, up to 300. Maximum dose of Sneha Basti, 300 ml, up to 300 ml for the adult. Purvakarma, Dosham, Dushyam, etc. we have to consider. Shodhana should be done. Then Abhyanga Sweda, Snana, Bhojana. Again, Bhojana. That is very important before Anuvasana Basti. Niruha Basti, Natik Shuddhartam is mentioned. But for Anuvasana Basti, Acharya says that after taking food only we have to administer the Anuvasana Basti. Otherwise, because of the Sneha, Sigdha Guna and the Tikshna Guna of Sneha, it may travel up to the mouth. It may pass through the colon. So to prevent that, we have to keep something above that. So that's why we have to ask the patient to eat food. After that, Anuvasana or Matra Basti, any of these Sneha Bastis are administered. The positioning, again, for the Niruha, same position, we should adopt in the Anuvasana Basti also. Again, one doubt. If a patient is having some severe spinal injury and we want to plan him some Basti. The patient is not able to lie down on left lateral position. What you will do? Okay, think. positioning is important here. The positioning is very important. The time of administration, generally it is given in the Madhyana, after the lunch. So that is why in the Sushma Samhita Acharya says that in the Pratha Kala, in the morning or Madhyana Kala, Niruha Basti should be given. After that, he has to take the food, and soon Anuvasana Basti can be given. So same day, Anuvasana and Niruha and Anuvasana can be given. So this is another practice. Some study during my PG time, one of my seniors, Dr. Lohit, he has done, he is coming, right? He has done his study on this only, the altered pattern, modified pattern of Basti Dravya. Yoga Basti doesn't mean that 8 days Basti. Yoga Ashto, 8 Bastis. It doesn't mean that it should be given in 8 days. 8 Bastis should be given. So that is why in this pattern, generally on the first day, Anuvasana Basti will be given. Next day, morning Niruha, afternoon Anuvasana. Next day, morning Niruha, afternoon Anuvasana. Morning Niruha, afternoon Anuvasana. Last day, Anuvasana. So 5 days, we can finish the Yoga Basti. Similarly, in around 9 days, we can finish the Kala Basti. Around 22 days, we can finish the Karma Basti. Okay. But again, the patient should be fit for that. Patient should have enough strength to tolerate both these Bastis in the same day. Pradhana Karma, Siddhe Kute, Akampana, Shane, Ruju. These are the important things. Akampana, Vepana, Lakhavadyu. Another thing, what is that? Ruju Anuprishta Vamsham. How the Basti should be administered? The Basti should be administered Ruju Anuprishta Vamsham. It should be straight. At the same time, it should be parallel to the Prishta Vamsham, spine or the vertebral column. It should be parallel to the vertebral column. But practically the problem is, if the patient is lying like this, and if you administering the Basti, this is the table, patient is lying here, and you are going to administer from here. It is not straight to the Prishta Vamsham. Always we have a tendency to push straight. Okay, so you are going to injure the patient. So that is why always insert with finger, gloved finger, and just insert the tip of the Basti Netra, then slowly tilt it before inserting completely, then make it parallel to the Prishta Vamsha, then slowly push it inside. Then after that only we have to push the Putaka. Again, while removing also we should be very careful, because you are standing on the side, you have always the tendency to remove it. So this is going to rub over the wall, rectal wall. So it may cause injury. So same way, you are already inserted, you are standing like this, slowly remove it, then get it back. So that positioning is very important while administering also. That is why Ruju Anuprishta Vamsham is mentioned by the Acharya. Ekagrahanenaiva dattam. That is another important thing. So if you are not experienced, Kampana, Vepana, everything is there. What do? You will push once, it will enter. Again you will push next dose. So repeated pulsating administration will be there. It may cause injection of the air also. Sometimes the patient may get the abdominal pain, etc. Savashesha Basti. Always should be Savashesha Basti. Need not be 50 ml or 100 ml Avashesha. Minimum quantity, maybe 20 ml or 30 ml, you can keep it in the Basti Putaka, so that to ensure that air is not entering to the body. If little amount of air entered, no need to worry, because it is a Vatasthana only. So no much complication is going to happen. Then Paschatkarma. So Niruha Basti, there is no Paschatkarma like Anuvasana Basti. But there is some mispractices are there. After Niruha Basti also, they are going to put the Tadana, pushing the leg and all. Wrong practice. We need not to retain the Niruha Basti. Again and again I am telling, need not to retain the Niruha Basti. Whenever it comes, naturally When the urge comes, let him fast. Even if it is within 1 minute, no problem. But for Anuvasana Basti, we have to retain the Basti Dravya. So that is why Acharya has mentioned Spik Padana, lifting the leg, both legs, etc. to divert the mind to keep the oil stagnant. Also, we can ask the patient to rub his hands or ask the patient to count reversely 99, 98, 97, so that his thinking will be diverted to counting. 1, 2, 3 he can easily, without thinking also he can count. But reverse it will be slightly difficult. So that's why we can ask him to do like that, so that this can be retained. Then Upadhana, we can elevate the split portion with the help of a pillow, etc. Then Abhyanga. Again, this is another important factor. After the Niruha Basti, if the Basti Dravya is not coming properly, or the patient is not having any feeling, we can do Abhyanga. Abhyanga to the abdomen in the clockwise direction. Because ascending, transverse, descending, sigmoid, rectum. So that we are going to enhance the movement towards the rectum, because we want to expel. But for Anuvasana Basti, while doing the Abhyanga, this is not mentioned in the text. This is because of our anatomical knowledge we are going to implement. For Anuvasana Basti, we want to retain the Basti Dravya. So what we can do? Anti-clockwise we can do the Abhyanga. So that we are enhancing its more movement towards the body. Okay. Then again, Acharika Vidhi you can follow. Then observation, Basti expulsion, wait for the Basti expulsion. Generally, if it is not expelled, around 150 ml of Sneha Dravya, if it is not expelled also, no problem. Next day morning, before giving next Basti, we should ensure that patient is having proper Kshuddha. That's all. If Kshuddha is not there, don't go for the next Basti. Wait. Then Kala Pratikshana for the Sneha Vyapa. That is the first line of treatment. Then 3 Yama is mentioned for the expulsion time. Then retention with the Bhadra, without early expulsion, etc. Leave it. Then Vyapad, Doshavarana. So Sneha Vyapads, Shadavata, you know. Purishavarta, Atyannavarta, Abhukta Pranita, and another things are pain of the man, dysentery, and pain in the anus. These are the another complications related with the Sneha Basti. Pain of the man, we can give some Swedana, Bhakya Swedana, hot water bag, etc. you can give to keep over the abdomen to reduce the pain abdomen. And again, some of the Deepana Pachana Dravyas can be given to get the Agni. Because due to the Sneha, Atiyoga, Mandagrita will be there. Due to that also pain abdomen will be there. So to overcome that, we can give Deepana Pachana. Dysentery. Dysentery again because of the Kledata and also Kapha Vritti. Kapha Vilayana or Kapha Haratva should be adopted. So again, Rukshana Chikitsa is advisable there. Okay, so this is about the principles and practice of Basti, Niruha and Anuvasana. So Namatra Matram Apyatra Kinchit Agama Varjina, one of my favorite shloka from Vagbhadacharya. So he shown that much of courage to say that whatever I written is not mine, because I borrowed it from my elders or other texts. Nowadays we don't do that. We never acknowledge. We never acknowledge anybody. That is a problem. Okay. So this is from my past few years experience, learned from my teachers, from textbook, and from patients. So okay. So after 3 weeks we will go for the different yogas of Bastis. I think questions last we will keep. Yes. If any questions are there. All together.
So we can have tea in the same hall where we have in the morning.